Hydrantist its p square. Let's learn an important topic of pharmacology, that is pharmacokinetics. Question comes in our mind, how drug goes into the body and why with time its effect decreases. What the body does to the drug, मतलब हमारी बॉडी ड्रग का क्या करती है, is called as pharmacokinetics. Drug means दवा. It is chemical substance used in treatment, cure, prevention or diagnosis of disease, or used to otherwise enhance physical or mental well-being. Pharmacokinetics has 4 phases, shortly ADME, that means absorption, distribution, metabolism and excretion. The last two together called as elimination. This picture shows basic concept of the topic as intake of drug, then absorbed in circulation followed by distribution in body, and metabolism to activate or facilitate drug excretion from the body. We wonder why action of drugs sometimes fails. This is because most of the drugs have lack of efficacy. Absorption, the process by which drug proceeds from the site of administration to the site of measurement, that is bloodstream within the body, which is required to produce therapeutic effect. Oral drugs undergo gastrointestinal absorption, in which drug is absorbed from the gut lumen into portal circulation. Question comes as, write on factors influencing GIT absorption of drug. Aqueous solubility. For example, टैबलेट को लिक्विड में डिसोशिएट होना पड़ता है बिफोर एब्जॉर्प्शन, पर सिरप इज relatively easy to absorb. More drug concentration, faster is absorption. Large area for absorption, faster will be the absorption. More blood supply, faster is absorption. Routes of drug administration. This topic was covered in a separate video. Click on the right corner to watch it. Frequently, question comes as note on bioavailability. Administrated drug की वो फ्रैक्शन जो कि सिस्टेमिक सर्कुलेशन में अनचेंज फॉर्म में मिलती है. It is 100% in case of intravenous injection and low for oral ingestion due to incomplete absorption and first pass metabolism in intestinal wall and liver. Area under the curve indicates absorption of drug, as area under the curve of A and B is same, means उनकी एब्जॉर्प्शन सेम हुई है, पर स्लोप बताती है कि A जल्दी एब्जॉर्ब होकर अपना थेरेपेटिक इफेक्ट प्रोड्यूस करती है, बट B डज नॉट. देयर C इज लीस्ट एब्जॉर्ब्ड एंड हैव लो बायोअवेलेबिलिटी. डिस्ट्रीब्यूशन, रिवर्सिबल ट्रांसफर ऑफ ड्रग between the blood and extravascular fluids and tissues of the body, which depends upon its lipid solubility, ionization at physiological pH, as lipid water partition coefficient of drug, association coefficient value of drug, of plasma protein binding, affinity for different tissues, fat lean body mass ratio, and diseases like congestive heart failure, cirrhosis. Blood-brain barrier. The capillary endothelium cells in brain have tight junction and lack large intracellular pores. Further, an investment of neural tissue covers the capillaries. Together, they constitute the blood-brain barrier. Redistribution. If the site of action of the drug was in one of the highly perfused organs, redistribution result in termination of drug action, like anesthetic action of thiopentone injected intravenously is terminated in a few minutes due to redistribution. Short note on plasma protein binding. ड्रग प्लाज्मा प्रोटीन के साथ रिवर्सिबली बाइंड करता है. ऐसे ड्रग प्लाज्मा एल्ब्यूमिन के साथ बाइंड करता है और बेसिक ड्रग्स अल्फा 1 एसिड ग्लाइकोप्रोटीन के साथ एंड बाइंडिंग टू एल्ब्यूमिन इज़ क्वांटिटेटिवली मात्रा में ज़्यादा इम्पॉर्टेंट है। ड्रग का जो पोर्शन प्लाज्मा प्रोटीन के साथ बाइंड होता है उसका ना ही मेटाबॉलिज्म होता है और वो एक्सक्रीट भी नहीं होता। फिर धीरे धीरे से ड्रग रिलीज होता है इनटू circulation resulting in long duration of action. Drugs highly bound to plasma protein are phenytoin, barbiturates, beta blockers, benzodiazepines, warfarin. In test of journal pharmacology, 10 mark question comes as define biotransformation, explain in detail various phase 1 and phase 2 reactions giving suitable examples. बायोट्रांसफॉर्मेशन मतलब ड्रग का केमिकली अल्टर होना टू मेक नॉन पोलर ड्रग पोलर सो दैट एक्सक्रीशन कैन अकर एंड दिस मैकेनिज्म प्रोटेक्ट द बॉडी फ्रॉम ingested toxins occur primarily in liver. It lead to inactivation of drug, example lidocaine, ibuprofen, paracetamol, or conversion into one or more active metabolites, example diazepam 2, dismethyl diazepam and oxazepam, codeine to morphine and morphine to morphine 6 glucuronide, or conversion of prodrug to active drug, example levodopa to dopamine, bacampicillin to ampicillin, which is an antibiotic. Biotransformation is classified as non-synthetic or phase 1 in which a functional group is generated or exposed. Second is synthetic or phase 2 or conjugation reaction in which an endogenous radical is conjugated to drug. Starting with non-synthetic reactions, oxidation means addition of negatively charged radical or removal of positively charged radical. They are most important drug metabolizing reactions, example hydroxylation, oxidation deamination. They are mostly carried out by monooxygenases in liver. Reduction is reverse of oxidation, example is warfarin, chloramphenicol, halothane. Hydrolysis means cleavage of drug molecule by taking up a molecule of water, as ester plus water is converted to acid and alcohol in presence of esterase. Example of drug is lignocaine, oxytocin. Synthetic reactions to form a polar highly ionized organic acid which is easily excreted in urine or bile. They are examples. Moreover, drug can directly go into second phase or first pass by phase 1 and then by phase 2 to get excreted. Glucuronide conjugation is most important synthetic reaction carried out by a group of UDP glucurinosyl transferases compounds with hydroxyl or carboxylic acid group easily conjugated with glucuronic acid. Example chloramphenicol, aspirin, anisad, diazepam, morphine. Endogenous substances like bilirubin and steroid hormones. Drug which is excreted in bile undergoes enterohepatic circulation and it prolongs action of drug. Example oral contraceptives. Acetylation, compounds having amino or hydrazine radicals are conjugated with help of acetyl coenzyme A. Example sulfonamides. Methylation amines and phenol by methyl transferases in which methionine and cysteine act as methyl donors. Example adrenaline, histamine, methyl dopa, sulfate conjugation, phenolic compounds and steroids by transferases. Example, sex steroids. Glycine conjugation, not a major pathway. Aspirin, nicotinic acid have carboxylic group, react with glycine. Glutathione conjugation serves to inactivate highly reactive quinones or epioxides intermediates. Example, paracetamol carried out by glutathione as transferases. In case of poisoning, large amounts of such intermediates are formed. Glutathione supply falls short. Toxic adducts formed with tissue constituents resulting in tissue damage. Ribonucleosides or nucleotide synthesis important for activation of many purines and pyrimidines, antimetabolites used in cancer treatment. A short note comes on microsomal enzyme induction. कोई भी ड्रग इंसेक्टिसाइड और कार्सिनोजन डीएनए के साथ इंटरैक्ट करता है, माइक्रोसोमल एंजाइम को इंक्रीज कर देता है, जिससे उस एंजाइम का सबस्ट्रेट का मेटाबॉलिज्म बढ़ जाता है. डिफरेंट इंड्यूसर्स आर सेलेक्टिव फॉर सर्टेन cytochrome P450 isoenzyme families. Example, anticonvulsants, glucocorticoids, CYP3A isoenzyme. Chronic alcohol consumption, CYP2E1. Induction involves microsomal enzymes in liver as well as other organs and increase rate of metabolism by 2 to 3 folds, reaching peak in 4 to 14 days and return back to normal over a period of 1 to 3 weeks. Consequences of microsomal enzyme induction: decrease intensity or duration of active drug, increase intensity of active drug, example acute paracetamol toxicity, tolerance or autoinduction, example carbamazepine, increase metabolism of some endogenous substances like steroids, bilirubin, activation of intermittent porphyrin. Intermittent use of an inducer may interfere with adjustment of dose of another drug prescribed on regular basis like oral anticoagulant like warfarin, oral hypoglycemic agents like metformin, antileptics and antihypertensive drugs whose metabolism is significantly affected by enzyme induction are phenytoin, warfarin, tolbutamide, oral contraceptives, chloramphenicol, etc. Possible uses of enzyme induction: congenital non-hemolytic jaundice, phenobarbital cause rapid clearance of jaundice. Cushing syndrome, phenytoin may reduce manifestations in chronic poisoning and liver disease. Question comes on first pass or pre-systemic metabolism. It is the metabolism of drug during its passage from the site of absorption into the systemic circulation. Orally administered drugs are exposed to drug metabolizing enzymes in intestinal wall and liver, where drug first reach through portal vein. It occurs of limited magnitude in skin in case of transdermal patches, and in lungs. It does not occur in intravenous administration of drug. Due to this, oral dose is considerably high than sublingual or parenteral dose. It varies from individual to individual due to difference in state of metabolism, and oral bioavailability is apparently increased in patient with severe liver damage. Excretion means removal of drug from the body. Important and major channel is urine, feces as bile organic acids and directly excreted drugs in colon. Example, heavy metals, exhaled air, gases and volatile liquids like general anesthetics and alcohol. Saliva and sweat is minor important. Lithium, potassium iodide and heavy metals. Renal excretion for excreting all water soluble substances. The amount of drug or its metabolites ultimately present in urine is sum total of glomerular filtration, tubular reabsorption and tubular secretion. Question comes on clearance and order of kinetics. Clearance is rate of elimination divided by plasma concentration of drug. Kinetics of elimination, first order kinetics is exponential, that is rate of elimination is directly proportional to drug concentration and clearance remains constant. Zero order kinetics is linear, that is rate of elimination remains constant irrespective of drug concentration and clearance decreases because with time plasma concentration of drug decreases. Example, ethyl alcohol. Question comes on plasma half-life with its clinical significance. वो टाइम जिसमें ड्रग की प्लाज्मा कंसंट्रेशन हाफ हो जाती है उसे प्लाज्मा हाफ लाइफ कहते हैं. इन दिस ग्राफ देयर आर टू डिफरेंट स्लोप्स अल्फ़ा एंड बीटा. जो अल्फ़ा स्लोप है वो डिस्ट्रीब्यूशन को डिनोट करती है और बीटा एलिमिनेशन को. एज अल्फ़ा स्लोप डिक्लाइन रैपिडली एज इट फॉलोज zero order kinematics, while beta slope is linear due to first order kinematics. Plasma half life of aspirin is 4 hours, digoxin 40 hours and penicillin G 30 minutes. Thanks. Make sure to share the knowledge with your friends. Keep supporting.